My name is Dr. Jeremy Rees. As the Clinical Pathway Director, my role will be to drive forward integration of brain cancer services and to improve the patient experience for patients with brain tumours, ensuring that as many patients as possible are treated to as high a standard as possible, embedded in clinical research, and overall improving ultimately outcomes, patient outcomes. Success in a difficult tumour to treat like brain cancer cannot simply be measured in hard terms alone like survival. Success has to be measured in terms of the quality of the patient experience, the standard of care that the patient has received, not just from the medical and oncological perspective, but also from the rehabilitation side, whether or not the patients are supported at home by community services, and of course that they are diagnosed in a prompt way. I think one of the biggest benefits is that they will feel that as they progress through their journey, through their cancer journey, they know where they're going and they know what they can expect in the next stages. If they are, for example, being moved from one centre which does neurosurgery to another centre which does radiotherapy, they will know exactly why they're going for radiotherapy, how long it's going to take, who they're going to meet, and what will happen afterwards. I think the most important thing is for them to understand that the way that an integrated cancer system works is going to be very different from the way that they have previously worked, in the sense that they have considered themselves as working for a single trust within a single unit, sometimes often doing a single job. And what the critical thing we're trying to get over is that this is now much more of a team effort, and that patients, although they may be treated in one particular trust for one part of their treatment and then another trust for another part of the treatment, should be seen as working in a much more integrated way than previously. What I think will happen is that there will be a much greater crosstalk, communication, liaison across different trusts and providers. This is not about rationalising services, making people redundant. It is about improving the patient experience, improving the patient pathway, and making the patient the centre of the pathway. The one message I'd want to communicate about London Cancer is that we are finally working together for the benefit of patients, rather than necessarily working in competition with each other.